Guys, today is an important video. This video is gonna help y'all who wanna become ER nurses and all that stuff. Okay, so you know what, let's just jump into it. My name is Tiffany. I've been an ER nurse for almost a year now. It's gonna be a year like in 1 week. I have accumulated some tips to help you guys, just some friendly advice that I would have liked to know before starting out in the ER. But this is what you need to know before starting out in the ER as a new grad nurse. So I started out in the ER. This is my first job, the first unit I've ever been. I was never a med-surg nurse. I was a tech. But I was never a nurse in med-surg before starting in the ER. And number one, the first thing that I can think of before starting out in the ER, something that I did was go over my cardiac rhythms, all the cardiac rhythms. We had to take a class that went over all the cardiac rhythms, and we had to pass that class before even being able to start out in the ER. And that is so important because most of your patients are going to be on a cardiac monitor, so you want to know what you're looking at. You know, there is the normal like sinus brady, sinus rhythm, sinus tachycardia, but you need to obviously know your lethal rhythms, your VFib, your VTach, your asystole. Maybe your job will make you go to a class like mine did, but watch videos on YouTube, go back into your nursing school notes, look at like junctional rhythms, idioventricular rhythms. You need to know what your rhythms are and learn them before you start. So similar to knowing your cardiac rhythms, you're gonna wanna know ACLS and PALS. You're probably gonna have to get those certifications. Most likely you're gonna have to get your ACLS if you're working in the ER. So ACLS, know your shit. Pay attention in ACLS because, honey, there's no rapid response in the ER. Like, you are the rapid response. If there's a code that comes in, like if somebody codes, like you need to be on top of your game. Like if all, like worst comes to worst, you need to know how to run that code. So know your ACLS, know your H's and T's, know your cardiac rhythms, and your medications. What do you give for SVT? When do you give atropine? All that ACLS stuff, know it. Like from the top to the bottom, in and out. ACLS is your Bible. Number 3, you want to treat the patient, not the monitor. Don't always be focused on looking at the monitor, looking at, you know, what's going on in the monitor. You want to like focus on the patient. If the monitor says your patient is in VTach, but they're like moving around or whatever, like your patient is not in VTach. Like calm down, take a chill pill, check the leads on your patient, because it'll say like asystole, but like one of the leads will not be connected to your patient and the monitor will freak out. Or if the O2 sat is saying like, oh, they're starting at like 86%, you want to check the pleth of the wave. If the wave is like flatline or if it's going all crazy, if your patient has acrylic nails or nail polish, if your patient's hands are cold, that is not a true O2 sat. Same thing with blood pressure. If their legs are crossed, that's like obviously a given one. Always recheck the blood pressure on the other arm. Use a different cuff, because sometimes like you can't always trust the equipment. So don't freak out, just calm down and just reassess the situation. This is something that stuck in my head that one of my preceptors told me, and it is to focus on taking care of the patient first and then documenting. If you're getting a patient that's coming in from the EMS and they're coming to your room, put the computer aside for a sec. Don't focus on typing in your little triage right away. Get the patient connected to the monitor. You want to see what the patient is like what's their friggin' vital signs before you start typing in your computer like, have you been exposed to blah 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 blah, any allergy? Like, just get your hands on the patient first before you start documenting. Always put care of the patient first before documenting. It is the ER. There is going to be emergencies. Sometimes people have allergic reactions. sometimes you're not going to be able to scan meds like right away. Sometimes you have to, you know, remember, oh, I gave this med at this time and like back time. It's not going to be a perfect world because it's the ER. Things happen emergently. You're gonna have to override medications in the Pyxis because someone's having a freaking allergic reaction and their tongue is swelling and they're about to stop breathing. So you want to obviously take care of the patient first and then document. Then document what's going on. This is something that you learn in nursing school, but if you didn't document it, you didn't do it. Nurse to CT. Report given to this. Attempted report. Literally everything you need to document, because then they're gonna look back and be like, you didn't even try to give a report. You didn't even try to put an IV in. You need to document everything, because if you didn't document it, it didn't happen. Document provider communication. I don't know if it's like this in all the ERs, but in my ER, they're really big on documenting provider communication. If we get a call from lab that we have a critical lab result, if the blood sugar is like super high, for example, and you tell the doctor, hey, their blood sugar is freaking 900, whatever, you have to document that. Ask doctors questions, ask nurses questions, ask the pharmacist questions, ask everybody questions. If you're not sure about something, ask, because it's always better to ask than to be wrong and to screw something up. For example, if there is a patient that is on dialysis and they accidentally ordered like 3 freaking boluses, do you really want all these boluses? Just double checking, just double check. If you're not sure, just double check. Say a patient came in with a blood pressure of like 190 over like freaking 107 or whatever it is, like a super high blood pressure, but then you retake the blood pressure and it's like 140 over 70, and the doctor had ordered labetalol, but it was based on that higher blood pressure. You want to question that order. You want to go to the doctor and be like, hey, like their latest blood pressure was 140 over 70. Do you still want me to give this labetalol? And most likely, again, they'll be like, no, don't give the labetalol, like hold off on that. I remember at first I would have a lot of questions about insulin, and like once like all the admission orders and all that stuff, or even just how to titrate drugs, glucomander, cardizem, like anything that's new. Obviously I had questions, so don't be afraid to ask other nurses questions. Don't be afraid to ask your charge nurse questions. Another thing that I would ask questions about is how to give a medication. So for example, if someone was being started on heparin and then they were ordered a bolus at first, I was like, oh, like how do you give this? Like, can you just come with me really quick and like go over it with me? And we did it and we learned. And the more you do things, the more you learn. Ooh, this is a big one. Make sure your area, your rooms are stocked. Make sure you're prepared. Sometimes you hit the ground running when you go to work and it's hard to make sure your rooms are fully stocked and whatever, but try your best to freaking stock your rooms. Make sure you have all the equipment you need. Make sure you have ambu bag. Make sure you have your suction equipment. Make sure your suction works. Literally, when I go into my room, I check the wall, make sure I have enough gloves, make sure my suction is there, my tubing, my suction tubing, make sure the suction works, make sure I have ambu bags, make sure you know where everything is, make sure you know where the defibrillator is, the code cards, make sure you know how to use the defibrillator or external pacing or synchronized cardioversion. Like, make sure you know how to use the monitor. If it's like a life pack or a Philips, make sure you know how to use it. With my preceptor, like, we went over everything in the trauma rooms. We would come up with scenarios. Oh my gosh, this week was so crazy. So we would come up with scenarios like, okay, so if someone is having like a severe allergic reaction, like what are the meds you have to give? Oh, Pepsid, Salamedrol, Benadryl, you know, Epi. We went over those scenarios and then like how to override everything in the Pyxis. And guess what? That same week, we had a guy in anaphylactic shock. And it was just good to anticipate the care, like know where things are, know the process of things. I was like, so what if somebody, like, I know we have a labor and delivery department here, but say someone like is delivering a baby, or like, you know, it's just like coming out and they end up having birth here in the ER. Like, how do we set everything up? And we went over that stuff, and guess what? That week, there was a delivery in our ER, which is like super rare. But it happened. Make sure you just know where everything is and try to prepare as much as possible. Be a patient advocate. Be the patient's advocate. You are there for them, no matter who they are, what they did in their life, whatever they do or whatever, you are there for them. You know, sometimes there's going to be a lot of miscommunication with doctors and inpatient doctors and yada, yada, yada. There's always a bunch of miscommunication. You are the patient's advocate. You want to do your best to kind of help them understand. Sometimes a patient will be like, you know, they won't understand something, and sometimes it's not your responsibility to explain it to them. Sometimes you need to get the doctor to come back and explain it to them. You know, explain, why are they getting a blood transfusion? Like, why are they getting this? Like, why are they being discharged? Why are they being admitted? Think of it as like, you know, if you were in their position, like that was your family member, like how would you want them to be treated? What kind of care do you want? Anticipating care. This is going to be a huge thing that you do in the ER, and a skill that you're going to develop very fast is anticipating care. If someone comes in with vaginal bleeding, what kind of labs are you going to draw? You're going to draw a pink top because, you know, just in case they need blood. Oh, you need to get the pelvic consent form signed. Oh, you're going to get the pelvic stuff because they're probably going to get a pelvic exam. You know, you just want to be proactive instead of waiting for the doctor to put in all the orders. If someone comes in with chest pain, put in that protocol for the EKG. If someone comes in with abdominal pain, do not wait for the doctor to go in there, see them, be like, oh, I'm gonna put in, you know, an order for labs. Like, if someone comes in for abdominal pain, you know they're gonna need labs done.